Welcome. This primer is designed to equip providers, researchers, and communities with the definitions, tools, and key takeaways to critically engage with AI. For level setting, consider that today's clinical decisions depend on vast volumes of data, far more than the human brain can process alone. Here enters artificial intelligence. Artificial intelligence, or AI, broadly refers to technologies that perform tasks traditionally requiring human intelligence, like learning, reasoning, problem solving, planning, visual perception, and language understanding, including speech recognition. However, we understand that AI, even with its many transformative applications, is not a replacement for providers or the healthcare workforce. Now, some additional definitions. Machine learning is a type of AI that learns from data to make predictions. Deep learning uses artificial neural networks to perform more complex tasks. These technologies adapt to evolving data and can generate new content, introducing challenges around transparency, oversight, and responsible use. In supervised learning, a dataset might include chest x-rays labeled as normal or pneumonia, allowing algorithms to make predictions on new unseen images as an example. Unsupervised learning uses unlabeled data to identify patterns without using predefined outcomes. Reinforcement learning helps improve decision-making in tasks like insulin dosing or when providing real-time feedback in dynamic settings like robotic surgery or ICU care. Now, deep learning. Think of a typical neuron. It receives inputs through dendrites in the cell body and sends outputs through the axon terminal, connecting with other neurons throughout the brain. Like the human brain, artificial neural networks process inputs and adjust over time to improve accuracy. At the foundation of deep learning, these networks are widely used in genomics, medical imaging, and clinical documentation. However, rapid integration without proper oversight can worsen bias and inequities, displace workers, and raise privacy concerns. In addition, over-reliance on AI may undermine critical thinking, all eroding patient trust. We will now explore some of these challenges. Our literature review found rapidly expanded use of AI since 2018, alongside the risk for amplified inequities. Bias stems from data imbalances, algorithmic assumptions, and unsafe deployment, risking unequal care. In addition, most studies overlook racial equity concerns and environmental impacts. Nevertheless, mitigation strategies are possible. Obermeyer 2019 found that a widely used health algorithm underestimated the needs of Black patients and measurably reduced access to care. Replacing cost-based proxies with direct indicators eliminated the bias. Additionally, environmental implications cannot be ignored. Increasing numbers of data centers can place significant strain on the Earth and communities, although renewable energy, if pushed, can strongly mitigate these concerns. We would like to elevate this 2024 radiology article highlighting strategies to reduce AI-related emissions while enhancing sustainability in medical imaging. Bioethical oversight is essential, and the 4 bioethical principles should ideally be applied proactively. Let's take a closer look. For AI, beneficence might mean ensuring data sets used to train algorithms are accurate, representative, and responsibly applied. Autonomy is about ensuring informed consent, ensuring transparency about AI use and its impact on care decisions. Justice means fair distribution of benefit and risk, equitable access to AI tools, education, study results, and fair distribution of environmental risk. Non-maleficence, finally, is about prevention, appropriately acknowledging AI limitations and correcting errors. A National Academy of Medicine publication on AI urges using population representative datasets, assessing for bias, and considering impact on communities, also centering equity within a quintuple aim, as noted in the chart. In closing, AI developers should ensure representative and diverse datasets, community and provider input, transparent and ethical AI design, environmental safeguards, and fair and accountable clinical integrations. We hope these points are useful as AI innovation and equity concerns become increasingly central in our lives and considering potential impacts for patients, healthcare systems, and biomedical research. Thank you sincerely for your time and attention.